Hi everyone, Dr. Brain here at another Facebook Live Tuesday. Today we wanted to talk about gum disease and how not only does it affect your teeth, but your overall health. Now, uh, you might think of gum disease as bleeding gums, for example, and at home you might have bad breath, or you notice that when you floss, if you floss, you get some bleeding gums, or when you brush you might get some bleeding gums, and you're like, I need to get a cleaning at a dental office. I need to go to my dentist. I've been putting off my cleaning. Oh my god, how long has it been? It's been years. But you don't have a lot of pain usually. You don't. It's like, I don't very similar to heart disease. It's a silent killer. With heart disease, there's stuff happening and you don't know. You don't actually have pain associated with it. Now, when this process is happening, the bone around your teeth is actually slowly going away as bacteria, these bad bacteria in your mouth, are getting trapped around your gums. This tartar builds up, that little hard tartar that the hygienist should be cleaning when you're at the dental office. That houses all this bacteria around your gums, and then the bone around your teeth starts going away. That's the process of gum disease. If that bone keeps going away over years and years and years, you're not having any pain, you're not doing anything. You're like, I'll go to the dentist when something hurts. Nothing's hurting, I'm fine. But the gum disease is getting worse. Gum disease is causing more and more bone loss. And as that process happens, you might actually start noticing a loose tooth or spaces actually between your teeth. And then when you start getting a loose tooth, you go, oh, okay, maybe I should go to the dentist now, and see what's going on. The dentist will take x-rays and say, hey, you know what? You have a lot of bone loss. The bone around your teeth are gone, and there's hardly any bone that's holding this tooth, and that's why it's now loose. And we're going to have to pull the tooth now. So you're losing a tooth. So this process that I just described, from the moment that, you might notice bleeding or bad odor to the point where you lose a tooth, is, something we don't want to see, but that's not the main damage that's happening. So the worst part here is not the fact that you just lost a tooth, or you might be losing multiple teeth. There's a much bigger problem happening. And that is that this bacteria that's festering around your gums is actually slowly going into your bloodstream. And as it goes into your bloodstream, it travels everywhere in your body. So gum disease is not just a tooth problem. It's actually, more importantly, a systemic problem. So it's causing a lot of problems throughout your whole body. So what are some ways it causes problems throughout your whole body, and it actually causes major health issues? Number one is heart disease. When this bacteria that goes into your bloodstream and now is going into your blood vessels, it causes inflammation. Just as your gums are inflamed, this inflammation goes into your blood vessels, and this inflamed blood vessel can cause a small constriction and cause heart disease. So now you have heart problems, and the doctor's like, well, what are you eating, and let me put you on some medication and other treatments. But the main problem could have been associated with your gum disease. Now, this bacteria doesn't just go to your heart. This bacteria, every time you take a deep breath, you're inhaling, and it goes into your lungs. And a lot of actual respiratory problems like COPD and other respiratory problems are also linked to gum disease. So, it's these bacteria just kind of traveling everywhere. Where else are they going? They're actually going into your joints. Now, a lot of joint problems like arthritis and inflammation that's in your joints is also linked to gum disease. But it doesn't stop at your joints. It actually keeps going. Now, if you're a pregnant woman, you are actually you're carrying a baby, and the bacteria that's constantly festering inside your mouth is going to other problem areas, and namely, it's going into areas where your for your baby. Now what that causes complications for your baby, and what that mainly causes is actually early births. So so it's super important if you actually are pregnant to get cleanings regularly and see a dentist regularly to make sure that your baby is going to be born healthy and vital. Next thing I would mention is your brain. Brain is not, is another area the bacteria go to, and so when this bacteria is going into your bloodstream, goes into your brain, and is strongly linked to dementia. So a lot of times we think, oh, I'm just getting older, I have dementia, but it doesn't necessarily have to be that way. We can improve your longevity by just being healthier, so that you're not you're less likely to get dementia, or maybe prolong the process. The next topic is interesting because this bacteria that is causing the gum disease is strongly linked to diabetes as well. Now, when you have diabetes, you actually have an increased risk of getting gum disease. And when you have gum disease, it worsens your diabetes and makes it harder to keep it under control. So it's something what we call is bidirectional. So it's, again, has major effects on your overall health. The last topic I wanted to talk about and how gum disease affects your everyday life is erectile dysfunction. Now, again, I was mentioning that when there is inflammation happening in your gums, these inflammatory markers are going everywhere. And again, inflammation is one of the worst things and linked to all kinds of health issues. But with erectile dysfunction, the blood vessels are getting constricted, just like heart disease, and the blood flow is restricted. So the blood flow can't go where it should, and so having erections or maintaining erections can be a problem. So if you're out there with bleeding gums, with bad odor, or if you know someone in that situation, there might be something much bigger happening here, and much bigger than tooth loss. Major health issues that we just went through are a big part of what you should be paying attention to. And if you're having these kinds of issues in your mouth, don't ignore them. You really should see a dentist. See a dentist that's conscious of the mouth-body connection. As far as we're concerned, we're holistic dentists, and we are very much conscious of your overall health and how the health affects your gums and how your gums affect your overall health. So if this helps you, comment below or just let us know.